Okay, we're going to go over cerebrospinal fluid and cisterns. Here's a list of anatomical features that you should be familiar with and be able to identify. For cerebrospinal fluid, we're going to just begin with identifying that it's a clear fluid made within the brain. It's cushioning the brain, allows the brain to float within your skull, providing buoyancy. The brain monitors the content of this fluid, for instance, by the level of oxygen and carbon dioxide, which can have an influence on various aspects of brain function. So the choroid plexus, identified in the green circles, is going to make cerebrospinal fluid. It creates it from within the brain. It ultimately circulates to the exterior of the brain and then is reabsorbed via these arachnoid villi. Here is a real brain that has been sliced open. We can see the layer of dura mater around the outside, but more importantly, I want to point out the fuzzy structures inside the ventricle. These are choroid plexus structures. This is where cerebrospinal fluid is made. This is what those same choroid plexus structures look like on an MRI. So now the lateral ventricles that the cerebrospinal fluid will flow through, we can see that in the red, in that rotating brain to the right, are the two lateral ventricles. They will then bring fluid down via the foramen of Monro into this flat, narrow third ventricle. And then there is a long neck-like structure that is known as the cerebral aqueduct. That's going through the midbrain, ultimately to the lower triangular region, and that is going to be the fourth ventricle. That will be just anterior to the cerebellum. Here we can see an MRI imaging. You should be able to identify that this is T2 and that the fluid is quite bright. So let's identify some of these structures. Here we have the foramen of Monro in yellow. It's bringing fluid down from those lateral ventricles. And then the third ventricle is just sort of in this little hash-marked shape because you're really actually seeing the thalamus. It's between the two thalami of each side. The squiggly blue line is going to be the cerebral aqueduct to the fourth ventricle in the green triangle. Now from this coronal view, we're actually seeing the posterior side of the brain. We can see the cerebellum below, and we can see the parts of the lateral ventricles. It's part of the horns as they go be posterior, and then we have the superior, and it's actually arching around to the inferior region here. And the squiggly lines inside, again, that's choroid plexus. We move a little more anteriorly, and we're also seeing the lateral ventricle. It's scooped like a ram's horn, so we're actually seeing this lower inferior horn and the superior horn, but we're still on the posterior side. We're moving even further anteriorly. Here are some of these structures. So we have the lateral ventricle. Notice centrally, that's where the third ventricle is. On either side would be the thalamus. And then we're seeing quite beautifully this triangular shape just in front of the cerebellum. That triangular shape is the fourth ventricle. The fluid, again, is bright in this image. So now we can see, again, the bright fluid. We can see the two lateral ventricles. There's a septum pellucidum that divides the center. Here's our third ventricle still shown. We've moved anteriorly, so we're just seeing the front of the pons, so we no longer see fluid down, cerebrospinal fluid down in the brainstem. Now we can see moving even more anteriorly. We're still just at the lateral ventricle. We no longer have that lower inferior horn. We're just having the superior portion as we move more anteriorly. Let's look at these from an axial view. We're starting from the most superior level and we're moving down. We can see these lateral ventricles on either side. We continue to move down. We can see the lateral ventricles with some choroid plexus inside. Farther down, we're seeing the lateral ventricles where we have an anterior and a posterior region. Moving down, we can see this anterior portion here. This is a foramen of Monro, bringing fluid down into this third ventricle region. As we continue to descend, we can see now we're in the midbrain portion, this little face here. That tells us that we're in the midbrain, and that little area here, a bright light there, that's going to be our cerebral aqueduct. It's bringing fluid down from the third ventricle. Then we're going to proceed and move down farther to where we can see the end of the cerebral aqueduct here at this bottom of the midbrain, and then we're at the level of the pons, and we're just starting to enter the fourth ventricle. This is a very narrow superior part of it, and as we descend, you can see that the fourth ventricle begins to enlarge more significantly. And then as we descend farther, we see some cranial nerves coming off, but see this tiny little white line. That is known as the lateral aperture. So that's where some of the cerebrospinal fluid is going to escape from within the brain and go out around. So now we can get cerebrospinal fluid around the outside of the brain. Here are some examples of pathology. Can you identify what ventricles are exhibiting enlargement? Each one has a normal view at a similar level for comparison. That is an obstruction that are causing the enlarged ventricles. So it's the lateral ventricles as well as the third ventricle. We see a very large third ventricle and two large lateral ventricles compared to the very narrow ones here in the normal. And then on this axial view, we really see these lateral ventricles significantly enlarged from that aspect. Now this is the sagittal view. We can see further enlargement and enhancement of the lateral ventricle and the third ventricle in comparison to what you're seeing just over here to the right in the normal image. So in this case, we can see that on the pathology slide, we see a nice triangular fourth ventricle. That's still normal. Cerebral aqueduct, you can actually see a black little line across there. That indicates that there's an obstruction. So everything more superior to that is going to be enlarged because it still has choroid plexus creating cerebrospinal fluid, but now it has nowhere to go as it descends. And so the lateral ventricles and third ventricles will just puff up and just continue to increase until this pressure is lessened. Here we see an infant about 1 month old, and we can see his lateral ventricle, in this case his left lateral ventricle, is significantly enlarged. We can actually see it here. There's an obstruction right there. We actually see this on the coronal view as well. We can see the different progressions as we go from posterior, which is more to the right inferior, and we start to move more and more anterior. So it's that lower horn of the lateral ventricle that's enlarged. Again, we can see another image from a different patient. We see a brain slice, or we see the choroid plexus. We see the posterior region of the lateral ventricle. Here's the anterior. And in this case, there is an obstruction and therefore a subsequent enlargement. So this is fluid accumulation on the right. Okay, so now we're going to go back to looking at the pathway of the cerebrospinal fluid. We start here where we go from the choroid plexus, the lateral ventricles, down the foramen of Monroe, into that third ventricle, and then across down to the cerebral aqueduct into the fourth ventricle. And then this will then continue down the spinal cord via a hole called the central canal. But we also have fluid that are going to escape via the lateral aperture that we noticed on the axial view. And there's this also foramen of Magendie that will also provide fluid that will go around the brain. So here's some colored versions of these cisterns. So these pockets of fluid on the outside of the brain, but within the skull, are known as cisterns. And there are different cisterns that are named for the structures that they are adjacent to. We can see here our suprastellar or chiasmatic cistern that's near the optic chiasma. We have the interpeduncular cistern, which is right anterior to the cerebral peduncles of the midbrain. We have the pontine cistern. So you know the word pontine refers to the pons. So that's going to be anterior to the pons. Premedullary cistern, well, that's in front of the medulla. Cisterna magna is just posterior, so we are just above the foramen magnum. We have supracerebellar cistern, meaning it's above the cerebella, and the quadrigeminal cistern. These structures here on the back of the midbrain are known as the corpora quadrigemina. So this space is the quadrigeminal cistern. Now we can find these on imaging. So we can see the quadrigeminal cistern. This little structure here tells us we're in the midbrain. These are the peduncles, and these are, and this is the posterior aspect. That's the top of the cerebellum. So that's our quadrigeminal cistern. Now we go a little bit further down, and so our interpeduncular cistern is going to be on the anterior side because these two little ear structures are known as peduncles. So this is telling you it's between the peduncles. Now the pontine cistern, we're further down. We see this very rounded structure of the pons. This black dot is actually the basilar artery, and all around that is the pontine cistern. Now we can see a sagittal view where we have all of these structures. The quadrigeminal cisterns on the posterior side, interpeduncular is on the anterior side, pontine is in front of the pons. We have a large cisterna magna here below the cerebellum.